This is ABC 7 Los Angeles.
Now, live from Los Angeles, this is UPN News 13 at 10.
Southland's #1 choice for news. Fox 11 News at 10.
A lot of men these days think that bald is beautiful. Some women, too. Think Sean Connery.
Battling baldness? In Focus, a revolutionary hair transplant method that really works.
He's definitely going to have more hair than he's ever had in the last 10 years.
A new hair-raising procedure that's producing amazing results.
Well, for some men, bald is beautiful, but thousands of others start looking for help when their hair does a disappearing act. New hair transplant technology is helping them get their hair back with a natural look.
We're in Focus tonight. The battle against baldness going high-tech now. A pricey new procedure promises a more natural-looking head of hair without long-lasting results, with long-lasting results, I should say. Larry Atterbury has a story for us.
The procedure isn't pretty, but this new micro-hair surgery is producing handsome results.
This isn't just an ordinary hair transplant. It's called a follicular unit transplant.
Hair is removed from sections of scalp and transplanted to where it's needed. The difference is the hair follicles are transplanted as they grow naturally.
There's some people that feel if you just do single grafts, it will improve things. But actually what we have found is it actually decreases the yield. It decreases the amount of grafts that survive.
When follicle units are transplanted, the look is much more natural than the old cornstalk pattern that told the world the wearer had a transplant. And follicular units have a higher survival rate than single hair grafts, so precious hair isn't wasted.
When we're dissecting, we're being able to see each and every follicular unit graft, so we're not traumatizing it. We're not cutting across these hairs.
Follicular unit grafting may be the most natural-looking hair transplant procedure yet.
I'm Dr. Paul McAndrews. I'm a board-certified dermatologist that specializes in the treatment of hair loss. For the next few minutes, I'm going to present to you information to help you determine the best treatment for your hair loss. Before we start, I think it's important for you to know, at present there's no magic bullet for the treatment of hair loss, and no one treatment for hair loss is right for everyone. Therefore, I believe my prime responsibility is to educate you on the medical and surgical treatment alternatives and benefits and limitations to these various treatments. With this knowledge, you can form an educated and realistic decision on how you want to go about treating your hair loss.
Dr. McAndrews, can you explain what hair loss is?
Let's first talk about 1, the normal scalp hair, 2, what is happening when you notice you're balding, and 3, the cause of male and female pattern hair loss, also called androgenic alopecia. In humans, hairs normally grow in cycles. There is a growing phase called an anagen hair, which grows for 4 to 7 years. Then the hair goes into a resting phase called a catagen hair, which lasts 2 to 3 weeks. And lastly, the hair goes into a fallout phase called a telogen hair, which lasts 3 to 4 months. This cycle continues to repeat itself throughout a person's life. Each scalp hair is at a different point of time in their cycle, and the average human sheds approximately 100 hairs a day. When it comes to male or female pattern hair loss, the growing or anagen phase becomes progressively shorter. When this happens, the hair starts miniaturizing, becoming progressively thinner, finer, shorter, until it becomes a miniaturized hair, which is cosmetically unnoticeable. We have miniaturized hairs all over our forehead, which for all intents and purposes are invisible.
What is the medical reason my hair is falling out?
The 2 main factors causing this miniaturization process, and thus baldness, are genetics and hormones, specifically the hormone dihydrotestosterone, or DHT. When your genetic light switch that controls hair loss turns on, the hairs under the influence of DHT become finer and thinner until they become miniaturized hairs. As far as genetics are concerned, you can inherit it from either or both your parents, not just from your mother's genetics as once believed. DHT is the hormone responsible for male pattern baldness. This was discovered when a family was noted to have a genetic defect in an enzyme called 5-alpha reductase. This enzyme breaks down testosterone into DHT. Without this enzyme, the male family members do not produce DHT and they never go bald. We know testosterone is a vital hormone in the male adult. It is necessary for your libido, your erection, your muscle mass, your bone density, and your ability to bear children. However, DHT has not been shown to have any beneficial effects in the male adult. It causes acne, prostate enlargement, hair loss in the male pattern, and hair growth, but unfortunately it's in the nose, ear, and back. So if we could inhibit this enzyme, 5-alpha reductase, we would have plenty of testosterone and we'd eliminate the detrimental effects of DHT. This is just how the drug Propecia works. In summary, men's hair in front and on top of their scalp has been genetically programmed to miniaturize, disappearing in the 30s and 40s under the influence of DHT.
Is there a specific pattern associated with my hair loss?
The scalp prone to balding is divided into 3 areas. 1, the vertex, 2, the mid-forelock, and 3, the frontal forelock. The hair on the sides and the back of the head have a different genetic program and is not susceptible to DHT, and therefore usually grows forever. The balding area does not represent bad soil or diseased scalp, but once your genetic light switch goes on, the typical male shows a specific pattern of hair loss. This pattern of hair loss has been classified by Dr. Norwood. The Norwood classification shows the typical stages of hair loss. Men progress at variable rates through these stages. We do know hair loss is progressive. Unfortunately, no one can predict where a balding man will ultimately end up. The 2 best predictive signs of how extensively a person will bald are 1, their genetic history, and 2, how early they started balding. Therefore, the worse your genetic history and the earlier you started balding, the more likely you will have extensive baldness.
What are my treatment options?
First, let's explore the various non-surgical options for the treatment of hair loss. Once again, there is presently no perfect treatment for hair loss. However, over the last several years, the medical and surgical treatments for hair loss have greatly improved. I think it's imperative each patient is realistic about what the various treatment options can achieve, and also know the pros and cons to them.
I've seen ads and infomercials on television that seem to promise amazing results. Can you tell me about these treatments?
Specifically, I can't tell you about each of these treatments, but I strongly believe it's imperative to briefly mention the scam or gimmick treatments for hair loss. There are numerous unethical companies who play on the vulnerability of balding men and women. These companies use the English language better than any politician does. What you think they said, they didn't, but they were hoping you would infer that. For instance, they'll claim their product removes DHT and may cause your hair to feel thicker and fuller. First of all, we secrete minute amounts of DHT from our oil glands, so anything, even my finger, can remove DHT from the scalp. Neither my finger nor these products are helpful for hair loss. Secondly, they use qualitative terms such as may feel thicker or fuller, which they can say legally. However, they never actually say their product could cause clinically significant hair regrowth. The reason being, 1, it doesn't cause hair regrowth. 2, the company could be sued if they made such claims. Therefore, be very wary of all the newspaper, radio, and television commercials you see on hair loss. And if you have any questions on specific products, please don't hesitate to bring them up during the consultation.
So what are the current pharmaceutical treatments for hair loss?
There are presently 2 FDA-approved drugs for hair loss, Rogaine and Propecia. Rogaine was the first product approved for the treatment of male pattern baldness. It is available over the counter in 2% and 5% concentrations. The patient applies it to the scalp twice a day. Its mechanism of action is unknown at present. I tell my patients that are using Rogaine not to judge the results for at least a year. Approximately 10 to 15% of my patients get some regrowth in the vertex of their scalp from Rogaine. Unfortunately, I cannot predict who will and who won't get results. The downside of Rogaine is that it can cause your scalp to get red and itchy and cause some dandruff. In women, occasionally it can cause hair growth in undesired areas, for example, the beard region. The biggest problem with Rogaine is compliance. Many of my patients are unwilling to use a product that they have to apply twice a day. Approximately 10% of my hair transplant patients use Rogaine. Now going on to Propecia. I think Propecia is on a different playing field than Rogaine. The results are much better than Rogaine, and compliance is much better since it's simple to use. It's an oral medication you take once a day, with food or without food, with medications, without medications, morning or night. It just doesn't matter. You just need to take it. Approximately 80% of my hair transplant patients are taking Propecia. Propecia works by inhibiting 5-alpha reductase, which inhibits the formation of DHT, the hormone that causes hair loss.
Propecia sounds quite promising. Are there any side effects?
One of the concerns with Propecia is its side effects. Propecia has an excellent safety profile. As a matter of fact, in the study group, more patients on placebo, a sugar tablet, stopped from side effects than did the patients taking Propecia. I've never prescribed another medication where this is true. I think the side effects of Propecia are blown out of proportion by unethical scam companies that don't want you using Propecia.
What are the side effects of Propecia, and what are my chances of experiencing them?
1.8% of the patients on Propecia had a decreased libido, compared to 1.3% of the placebo group. 1.3% of the patients on Propecia had an erectile dysfunction, compared to 0.7% of the placebo group. Therefore, most of the side effects were due to the power of insinuation. If I give you a pill and tell you you might get a headache, I'm increasing the likelihood you'll get this headache. And of those patients in the study group that did get side effects from Propecia, 58% of them had resolution of the side effects while continuing Propecia. In all patients, the side effects resolved if they stopped Propecia.
I've heard that sterility is a possible side effect. Is there any danger of this happening to me?
Extensive studies show Propecia does not affect sperm concentration, sperm motility, or sperm morphology. Therefore, Propecia does not affect spermatogenesis or semen production in men and will not affect your ability to have children.
If I'm planning to become pregnant or already pregnant, can I take Propecia?
Women who are pregnant or may potentially become pregnant should not take Propecia because it may cause abnormalities of the external genitalia of a male fetus.
Is there any risk to my unborn child if my husband is taking Propecia?
Exposure of pregnant women to the semen of men who are taking Propecia is not a risk to the fetus. I have some patients who are afraid that their Propecia tablets cannot be in the same house as their pregnant wives. Propecia tablets are sugar-coated, and therefore handling these tablets by a pregnant female is not a risk. A pregnant woman, however, shouldn't handle broken tablets.
Does Propecia pose any risk to my prostate health?
The active ingredient in Propecia has been used for numerous years and no long-term side effects have ever been shown. As a matter of fact, there's an ongoing study looking at the potential decrease in risk of prostate cancer in men taking the active ingredient in Propecia. The one thing to be aware of is Propecia can lower the PSA level or prostate-specific antigen in male adults. This is a blood test that is used to screen for prostate cancer in older men, usually above the age of 50. This test still is just as accurate in men on Propecia. It just lowers the upper limits of normal. Therefore, you just need to tell your doctor you're taking Propecia.
What results might I expect taking Propecia?
Propecia works the best on the back of your scalp or the vertex. 66% of men had some regrowth in the vertex, and 99% had no further hair loss at 2 years. Of the patients who had improvement in the balding vertex in the 2-year study, the results were broken down into 1, great improvement, 2, moderate improvement, and 3, slight improvement. 5% of the men had great improvement. 31% of the men had moderate improvement. 30% of the men had slight improvement. At 5 years, 90% still had no further hair loss or regrowth in the vertex. The 5-year study also showed the difference in hair counts between Propecia and the placebo group continued to increase to the point that at 5 years there was a 277 hair difference. This is approximately a 20% density difference in the hair, which is very significant. Propecia does not work as well in the anterior midscalp as the vertex, but still 42% get some regrowth and 95% had no further hair loss at 2 years. No studies have shown Propecia can cause regrowth of hair in front of the frontal hairline. Presently, Propecia is by far the best medical treatment for male pattern baldness. Studies have also shown the earlier you start Propecia in the balding process, the better results you will achieve. It is important for the patient not to judge the results for at least a year. As this picture displays, there is very little, if any, noticeable cosmetic improvement at 6 months. However, at 2 years, this patient had obtained significant improvement, which he would have never realized if he stopped the medication prematurely. When a patient asks me how long they need to be on Propecia, I respond by asking them how long do they need to continue to brush their teeth. Toothpaste is not perfect, but it can stop and or delay the onset of tooth decay. Just like Propecia can stop and or delay the onset of hair decay. If you stop using toothpaste, you will develop cavities and lose its benefits. If you stop Propecia, you will lose its benefits over the next year or two. The medical treatments for hair loss, such as Propecia, do have advantages over the surgical treatments. As a hair transplant surgeon, I'm just taking good genetic hair from the sides or the back of the scalp and transferring it to the balding area. There's no net gain of hair to the scalp. The good genetic hair that I transplant will usually grow forever, but I cannot control what is going to happen to the existing hair that is predisposed to miniaturize, where medical treatments potentially can stop the further progression of baldness and regrow this genetically susceptible hair. Therefore, there can be a net gain of hair.
Dr. McAndrews, can you explain the concepts governing hair transplant?
If you look at any balding man, you will notice that he never goes bald on the sides and the back of his scalp. This is good genetic hair, and we call this his hair bank. We can take this hair and transplant it anywhere, and it will usually grow forever. This is what we call donor dominance. If you transplant hair from a certain part of the body, it will always grow like it did from the original donor site. So in hair transplants, we just take hair from the patient's hair bank and transfer it to the balding area.
What are the most important goals to a hair transplant?
The three most important goals of hair transplants are to make it look undetectable and as natural as possible, to ensure the highest percent of the transplanted hairs survive and grow, and lastly, and most importantly, to be conservative. These last two goals focus on the limitations of hair transplants.
Please tell me all you can about the limitations of hair transplantation. I want to be as realistic about the results as possible.
When it comes to hair transplants, I wish I could tell you that it was the answer to every person's hair loss. Unfortunately, I would not be telling the truth. Hair transplants have evolved immensely over the last several years, to the point you should not be able to tell who has or who has not had a hair transplant. However, one of the last remaining limitations is that every balding person only has a fixed amount of good genetic hair in his hair bank that can be transferred to the balding area. Therefore, as a transplant surgeon, my primary and utmost focus should be to ensure the highest percentage of grafts survive and grow, and to use the hair bank judiciously to ensure the hair transplanted will stand the test of time. This focus respects the limitations to hair transplants, and any technique or technology that respects this limitation should be used, and any technique or technology that sacrifices this limitation should not be used. With this knowledge, you will be able to obtain realistic expectations on what I can accomplish for you. And more importantly, with this knowledge, you will understand why I perform the hair transplant procedure the way I do. Every step of my hair transplant process is subject to the question, does this step ensure the highest percentage of grafts survive and grow?
I understand that I have a limited amount of good genetic hair that I can have transferred from the side and back of my scalp to the balding area. The most important question I have is, how much of the hair bank can I use to cover the balding area? And will this significantly decrease my appearance of balding?
What this all comes down to is the density issue. A person needs to lose over 50% of his hair before it's cosmetically noticeable to the average person. This is a very important issue in hair transplants. One, we now know we can take up to 50% of the hair out of the hair bank without it becoming noticeable. And two, with respect to the balding area, 50% density is the most we'd want to achieve, since transplanting more density than this is not going to be cosmetically noticeable and is not an efficient use of the precious fixed hair bank. And again, there are many patients that do not have enough hair in their hair bank to achieve 50% density everywhere. This is the concept of supply and demand. The person who is balding the most and has the least supply in his bank demands the most transplanted hair. This is where realistic expectations come in. And if expectations and reality are not on the same page, then it is my responsibility not to perform the hair transplant. However, with realistic expectations, most patients will achieve their desired goal.
Can the procedure leave a visible scar?
Anytime you remove tissue from the body, you will produce a scar. However, the scar in the back of the scalp should be hidden by even a short haircut. Many times, it's very hard for the patient and the doctor to even find the scar.
I know this sounds a bit direct, but why should I choose you as my doctor over the other clinics I have investigated?
Over the last several years, most doctors have tried to automate the hair transplant process in order to perform numerous hair transplants on the same day. And in doing so, they have effectively taken the physician out of most of the procedure and replaced him with a technician. In most of these bigger hair transplant clinics, the doctor just takes out this strip of donor tissue and lets the technicians dissect and transplant these grafts largely unsupervised. I failed to see the quality in this and believe the doctors should be doing the surgery. I was formerly trained in hair restorations in a residency program and currently am an instructor at the USC School of Medicine. I instill in the residents that the physician is the person who should be performing the hair transplants. That technicians should be there to assist the doctor, not replace him. There is no other surgery performed that I can think of that the technician, not the doctor, performs most of the surgery. Typically, a hair transplant lasts 4 to 7 hours, and since I'm involved in every step of the hair transplant process, I can only perform one a day. My undivided attention belongs to this patient because I realize this is one of the most important decisions a patient will ever make about his appearance. It also respects the patient's desire for privacy and confidentiality.
What are the advances in the technology that maximizes survival of the grafts and respects the limitation of hair transplants?
There have been 2 recent innovations that have revolutionized hair transplants. The first is transplanting each individual natural hair grouping of hair as a unit. And the second is the use of the stereoscopic microscope to dissect out these natural hair grouping grafts.
What do you mean by natural hair groupings?
Hair does not just come out of the scalp individually, one by one, but actually grows in natural groups of 1 to 4 hairs with a fibrous sheath around them. Therefore, since this is how God designed everyone's scalp, this is how I perform hair transplants. I transplant the single hair grafts on the hairline and the natural groups of anywhere from 3 to 4 hairs farther behind for density. The benefit of transplanting these individual natural hair groupings is the completely natural look I achieve and the higher survival rate of the transplanted grafts.
How do you achieve a natural hairline?
The key to designing a perfectly natural hairline is 1. To be conservative in the design. 2. To use only the 1 hair natural hair grouping grafts on the hairline. And lastly, create an irregular frontal hairline. Hairlines should not be perfectly symmetric because it is unnatural. The human eye is drawn to straight lines on the body, and that's not where you want a person's attention.
I've heard the term single hair micrografts. Won't it look more natural to transplant 1 hair at a time?
Many doctors now separate these natural hair groupings into all single hair micrografts and transplant the hairs that way. Separating these natural hair groupings of hair causes much trauma and is going against nature, which is supported by a study published in the Journal of Dermatologic Surgery showing that the survival and the quality of these grafts markedly decreased. I think God is an excellent architect. Therefore, I try to mimic his pattern instead of trying to change it.
What is the stereoscopic microscope, and how is it a benefit?
This is probably the most important innovation in hair transplants. The natural hair groups must be preserved intact during dissection to ensure survival and growth. While dissecting the donor hair, it is impossible to ensure the intactness of the natural hair groupings without the stereoscopic microscope. Many doctors dissect with the naked eye or with minimal magnification, which leads to increased transection and destruction of the hair. The most precious commodity of a balding man is his donatable hair. The use of the stereoscopic microscope to dissect out the grafts enables us to visualize each and every natural hair grouping. By using the microscope, the trauma to the surrounding hair is greatly decreased, and we're seeing superior quality grafts with a much higher incidence of survival. I can now achieve survival rates much higher than the other currently used techniques. The microscope also enables us to trim away excessive tissue from the hair follicle. Therefore, smaller incisions can be made, which enables us to place the grafts closer together to give a denser look.
What are the other technologies that are being used in the hair transplant process that potentially sacrifices the hair bank and ignores the limitations to hair transplants?
There are many. Laser hair transplants, mega session hair transplants, having the medical technician perform the transplant. Performing 3 to 4 transplants a day, and improperly trained physicians can all contribute to an unsatisfactory result. But specifically, any technology being used in hair transplants should be subjected to the question, does this technology ensure the highest percent of grafts survive and grow and respect the limitations to hair transplants? Unfortunately, much of the focus of recent technology has been to try to automate the process for the doctor, which ultimately may become a detriment to the patient.
Why don't you perform laser hair transplants?
New technology should be used only if the benefits outweigh the risk. The benefit to the doctor is there's less bleeding using a laser, and therefore the doctor can perform the procedure in less time, and time is money. This is of no benefit to the patient and actually is a huge detriment. The downside of the laser is, 1, it can stop all bleeding, which is needed to nourish the hair. It's like trying to plant seed in dry soil. 2, there are studies showing decreased survival of grafts. 3, it can destroy existing hair and prior transplanted hair in the recipient area. And 4, the transplanted hair, if it survives, takes longer to grow in.
Why don't you perform megasessions?
My patients and I would love to get from point A to point B as fast as possible. Unfortunately, if the transplanted hair does not survive, I've done my patient a horrible disservice. I wasted his or her money, and most importantly, I've wasted something that can never be recovered, and that is the fixed and limited amount of donatable hair from the hair bank. There are several studies showing when the grafts are placed that closely together, the survival of the grafts decreases. I think it's unwise to potentially waste this supply because the doctor or the patient is in a hurry.
Do you feel the doctor should strictly perform hair transplants and no other procedure?
I think a properly trained doctor can perform other procedures. I believe the 2 critical aspects of a doctor performing hair transplants are, 1, he is properly and formally trained under the strict guidance of a residency or fellowship. I don't believe taking a weekend course or on-the-job training at one of the big clinics is adequate. And the second critical factor is the doctor should be involved in every step of the hair transplant procedure. I don't see how a doctor can master any procedure that he has his technicians performing.
Do you believe you need to perform 3 hair transplants a day, 5 days a week, to be the best hair transplant surgeon?
I believe quite the contrary. If this question were true, McDonald's would be a 5-star restaurant. I feel when you run an assembly line, the patient gets lost in the shuffle and the quality drastically decreases. As doctors, we are human, so we can only be in one place at a time. Therefore, if we are performing 3 or 4 hair transplants at the same time, there will be 2 to 3 patients having the operation performed by the technicians unsupervised.
Is this why you do only 1 hair transplant a day?
I believe in quality, not quantity.
Do I need to wait until I'm completely bald to have a hair transplant?
We can now insert grafts in between your existing hairs, leaving them undisturbed, which will systematically restore the density to your scalp hair. Thus, the grafted hairs may compensate for the loss of your natural hair. The successive placement of many of these grafts over several sessions can even prevent the appearance of baldness in selected patients with remaining but thinning hair.
How many sessions of hair transplants will I require to achieve the density I desire?
This is a difficult question to answer and is unique for each patient. The key factors to determine the number of hair transplants necessary to achieve a patient's desired density are: 1. What is a patient's present density of existing hair in the balding area? Recall, this existing hair is not good genetic hair and has the potential to decrease in density with the aging process. So it's important to always have some of the donor hair to compensate for this. 2. What is the desired density in the balding area, and is this realistic? The most I feel comfortable transplanting in a balding area without potentially sacrificing the survival of the grafts is 20% density. Therefore, if a patient's desired density is 50% in a completely bald area, he will need at least 3 hair transplants. If a patient's desired density is 30% density, and he already has 10% densities, then we will only need to perform 1 hair transplant to achieve this patient's goals.
I had a hair transplant done several years ago that, frankly, I'm not happy with. Can you make an inferior transplant look better?
Much of my practice now deals with repair work. All patients that have the cornstalk look can now be corrected to have a more natural hairline. Even patients with abnormally low hairlines can have those plugs removed, dissected under the microscope, and retransplanted in a more appropriate area.
Does the hair transplant procedure hurt?
Most of my patients say it's a lot less painful than going to the dentist.
I'm concerned about maintaining anonymity. How do you assure this?
First of all, the professionalism of my staff is of the utmost importance. They understand the sacredness of doctor-patient confidentiality. Secondly, we perform only one hair transplant a day, so we don't have patients coming in and out throughout the day. And lastly, since we perform only one hair transplant a day, we don't need to have a large staff that is constantly turning over. We have a small, very experienced staff. Thank you for watching this presentation. We appreciate your interest in our office, and thank you for the trust you place in us. My emphasis is to continue to be the best hair transplant surgeon and provide complete satisfaction to my patients. You should proceed with a hair transplant only after becoming thoroughly educated with the procedure and realistic about what can be accomplished for you. If you're undecided whether you want a hair transplant, you should not have it performed, and definitely do not let anyone talk you into it. You're the only one who should make that decision. Hair transplants have a very high satisfaction rate when these guidelines are followed. Once again, thank you for watching.